All right, so I just want to wish you all a warm welcome to this session. That's moving from vaccine hesitancy to acceptance, learning from the COVID-19 peer hub case study. So we have over 700 scholars that developed a case study on how they were able to handle an issue of vaccine hesitancy. So some basic ground rules. When we start, please, I'd just like to invite you to type in your city and your country in the chat so we know exactly where you're joining from. And we encourage you to your active participation. While you're listening to the panelists, please feel free to type in your comments on the chat and ask any questions that you may have. Please avoid to click on the ask to share audio and video button unless you are invited by the speakers to join the panel, because it may be bothersome to us who are actually trying to moderate the session. Now, how will our session work? So I'm going to invite our panelists to share their story on how they successfully handled a vaccine hesitancy challenge and what we can learn from their experience. And as I was saying earlier, while they are speaking, if you have any questions or comments, you can type them on the chat. Our eyes will be there to read out your comments and your question when the time comes. Then we will turn to our speaker and panelist, François Gasse, for his comment. He actually was with us throughout the process during the COVID-19 peer hub exercise on vaccine hesitancy. So he'll listen to the story and share his comments. And then we'll have a final Q&A session. If we can get up to 2 stories today, that would be great. If it's just one, no problem. Okay, so I'm going to share in the chat the link to where you can get the resources for the session. But basically for this session, there is no PowerPoint. So it'll probably be the resources for other sessions. So we are going to be inviting our panelists to answer these questions. So that said, I hope you're seeing my screen clearly. And I want to thank you, Charles, for taking out the time to invite those who are on the participating in the session to typing their comments on the chat. So Charles, if you can see my screen clearly, I'm going to hand over to you to invite our very first panelist for the session. That's Maria Monzon. So please go ahead, Charles.
Thank you very much, Charlotte. Thank you very much, Charlotte. Another panelist.
Please, can you ask to share your your video? And ask to share your video and your audio so that I can invite you into the panel. Okay, Charles, so if you're getting me, over to you.
Okay, thank you, Charlotte. Thank you, other panelists. Sorry, I'm having a little technical issue, but this conference really rocks. So please, at this point, I would like to invite panelists, if it's ready, please ask to share your video and audio so I can let you in. Then, if it's not ready, then I'll call on Maria. Okay, Sabati, Mitra, yeah, welcome in. You're welcome. Welcome in. So I would like to call on Maria from Argentina, right, to share your story with us. Then for those listening, please, at the end of the story, we'll be taking your Q&A in the chat box. So put your questions in the chat box. We'll be taking it from there. Thank you very much as we listen to Maria Fernanda from Argentina. The floor is yours, Maria.
Thank you, Charles. Thank you, everybody, for being here. And well, I'm going to share my story about vaccine hesitancy, the one that I presented during our last year. So following I am a medical director of a health center. I'm a pediatrician in a small city in the northern part of Argentina. My health center attends to about 7,000 people. And one of my weekly duties is to go to a health post where I can for all the week. So I go with a list of the vaccines that I need, calendar vaccines, and I take them once a week to my facility. So in this particular situation, where I go to pick up the vaccines, it's the center for the whole city. So about 36 health centers get their vaccines there every week. and there's a nurse in charge of that. And I always, start small conversations. I go there, and this happened last year in the middle of the pandemic. I approached her. I was waiting for my list of vaccines needed, and I asked her if she had felt that routine vaccinations, the demand for routine vaccination had decreased center, and if it was the same over there. And her answer was, with this particular word, sadly, parents are still bringing their kids to vaccinate. Although I tell them that there's no need to do that, that they have to stay home, that kids can get their vaccinations later on, because of COVID, it was dangerous. So first, second after that, I was shocked, of course. And afterwards, because the head nurse, you're, facing colleagues, and you never want to go, like with a bomb to them, to go kindly and smoothly. I was telling them that actually COVID was not a reason for people not to come vaccinate, and that all over the world, because we can take vaccination has to still be encouraged. That that in my center and in hers too, with the basic things that we do, the protection equipment, the distance, the face, everything, vaccination is a safe act, and kids have to keep on getting vaccines every time. So it was a casual conversation. I think it was the time, it was needed at that specific time. Of course, we could have done, more trainings or speak about how to protect ourselves and how to explain to parents that it's safe to come and get the vaccines. And that is a necessary, it was a step for after, but at that time, I think that was the way to approach the issue and not to just let it go. I got a very good feedback in the sense that she accepted it. She agreed with me. I mentioned that I was, involved with the Peer Hub and the Geneva Learning Foundation, that all over the world, vaccination, had actually not stopped, that we are still vaccinating every kid, and we are still asking for every parent to bring their kids, that nothing has changed there because of the needs that children have of vaccines, of routine vaccines. So I think the most surprising thing of this is that we always, that the hesitancy comes from the parents in the case, of kids vaccinated, but it's not necessarily that. The COVID pandemic has caught us all off guard, and a lot of health workers, and this shows it, at the beginning, or when we were just starting to figure out how to do things, they really didn't know how to act, or what was a needed a practice like vaccination, and what could have waited for later on. So that was my case. Thank you all for listening. I'm going to mute myself now.
Very much, Maria. That was a very wonderful. Actually, from your story, and it's in all that you did, because if you are not passionate enough, you won't be able to stick through and to get results at the end of the day. We appreciate you so much, and we are happy that you succeeded at the end. So please, you have questions. We are looking at the questions chart to have maybe one or two questions. Like I have one question here from Mwagi. We'll quickly take one or two questions before we bring you ready to give evidence. Then you give us the feedback on this presentation, right? So there's a question from Mwagi, and it says, how can we overcome health worker-related vaccine hesitancy challenges? In your opinion, maybe you want to tell us like how you feel we could actually overcome health worker-related vaccine hesitant challenges from your own concept. And then I think we have another question here. Looking at, let me see, is there another question? Well, seems like there is no other question. So, Maria, could you take that question before we bring in Francis?
So, I'm the experienced one. I'm sure we can hear from the rest of the panelists later. But I think that with health workers, the main thing, like with other people, is training, right? So here, because of what I explained, the pandemic didn't give us a lot of time to train about how to react to different situations. So I think that once you encounter them, you can prepare better to see and to know that it's not only happening in the parent or patient area, that it can also happen on your side, on the health workers. So trainings, and specifically, I don't think in this case the vaccine hesitancy wasn't about a particular vaccine. It wasn't that, you know, somebody didn't want to take this or this other vaccine. It was about vaccination itself because of the fear to catch COVID in the Vaccination Act. So I think that mostly training and how to approach and to make it a safe place to go is the main way to go with that.
Very much, Maria. We appreciate you. Thank you very much for that wonderful presentation. So please, Francos, please, I hope you are ready to give us one or two inputs, like feedbacks. You have any feedback for Maria? Please unmute yourself and go ahead.
Yes, I've unmuted myself. I hope.
Clear.
Yeah. Okay.
Clearly.
Thank you, Maria, for sharing this success story and putting out a critical piece of information that you are sharing, that we tend to accuse the mothers. Then sometimes the health worker are also hesitant, and an hesitant health worker will make a mother hesitant. So I think you highlight a very good point, that we focus on ourselves as workers before we consider that mother as a guilty one not to come. So thank you for putting that. And then you added something very interesting, which was how do you prevent health worker to be hesitant? And I think what I heard from you is that you say training. Now, those health workers may have never received before the proper information on what to say to mothers who hesitate, and they are themselves not a bit hesitant because they lack information. And I have one question for you, of course, this comment was, you know, I don't know if in your country, in your area, there was a double message sent from the Ministry of Health at each level saying, COVID is dangerous, don't go to the health center. I know in many countries that even the health center was the most hesitant to go. If there was one case, they would not go to the health center. So this was giving an image. So in your country, at the beginning, was there a message, stay home? Because it could be very confusing for the mothers. And how did you address that? Thank you.
Exactly, you're right. It wasn't an official message, but you know, the people would think, okay, if you're sick with COVID, you would go to the health. If I'm not sick, my kid needs a vaccine, I'm not going to go to the health center. And that it wasn't obviously a public message, but it was what was going on parents and among the people. You know, let's stay away from the health centers, even if you're thinking of something that is safe and it's to prevent other diseases like vaccinations. So
thank you. Second question is that how do you reassure mothers? You share with us the stories you tell mothers, but was at that time, was the equipment all in place? Because at the beginning there was no equipment. So I would have hesitated as a mother to bring my child if there was no equipment and the risk of contamination. So how were all health center equipped when you convinced that mother, or that health worker, I mean?
Thanks. No, thankfully, here from the beginning of the pandemic, every health center had the complete entire protection gear. There was no problem with that. It's just that health centers were empty. Nobody was coming, not even to get vaccines. They were just, you know, stuck at home, and nobody wanted to leave their houses. But we did have the equipment, thank God, in this case.
Okay, thank you very much. Over to you, Charles. Thank you very much for sharing those answers.
Thank you very much, Francos. That's wonderful feedback we have there. Maria, I hope you've learned one or two things from Francos' experience. Most of the questions he actually raised are very, very pertinent questions that you really, really need to imbibe in. You know, probably because now you need to know how you are able to overcome most of those challenges. Some of them are actually there, but then the way and manner in which you overcome them tells a lot, and it really gives an insight on what people to do when they are faced with such challenges. So, because I don't know if we have to take. Yes, Charlotte?
Yeah, please, if you just to indicate that there are lots of questions that are coming up on the chat concerning how can you overcome vaccine hesitancy in this situation or that situation. Just to share with you that our presenters today are alumni from the COVID-19 peer hub, and they did the exercise on vaccine hesitancy, and they are sharing real life experiences. They may not be experts in the various settings in which you ask your questions, but our hope is that in the course of the sharing and with feedback from François, you're going to learn something that will give a leading answer. And I'm also seeing many comments in line with ideas on how to overcome vaccine hesitancy that are coming up on the chat. So what we'll suggest is that we'll get our second panelist now, and then at the end, we'll get François' feedback, and then we'll focus the rest of the session on the Q&A. Thank you very much, and over to you, Charles, to introduce our next panelist.
Thank you, Charlotte. Thank you very much. So I think that's a wonderful one. So please, quickly, we're going to bring in Satabdi Mutra from India. I hope you are ready, Satabdi, to share your experience with us. The floor is yours. Over and out. Are you there?
Yes, hello. Yeah, I'm here.
Okay.
Actually,
okay, please, the floor is yours.
Hello, hello. Yes.
We can just.
We can hear you.
In our country now, we have. Yes, can you hear me?
Yes, we can hear you.
Hear you, Satabdi.
We can hear you.
Okay, thank you. In India, we have just launched the COVID-19 vaccine, and I like to share the experience we are facing now.
Yeah.
Because in the first, it is the first phase when we have launched it only for the healthcare service provider.
Please, can you start by telling us who you are? Can you start by introducing yourself, please?
I'm in. Hello.
Hello, Satabdi, if you can hear us, can you start by introducing yourself to us? Tell us who you are. Yeah, you are audible. You are audible, but start by telling us who you are. Yes, you are audible, Satabdi. You are audible. Can you hear me?
Am I audible? Yes. Dr. Shatabdi Mitro, I am working as assistant professor. I am working as epidemiologist in a medical college hospital in Kolkata, West Bengal, India. And I'm an extra, that is the additional of the supervision of routine immunization. And in my country, on 16th of January, we have launched COVID vaccination. In the first phase, we have launched it just for the healthcare service providers. And there is very huge hesitation, and a number of the persons, they are refusing this one. So, refresh the page. We have to refresh.
Satabdi, are you still there? We can't hear you anymore. Is it just me, or have we lost Satabdi?
Oh, I think the network are there. I think we've lost her, Charlotte.
Okay, so while we hope that she gets back, I just want to, there is Wafa Abdul Rahman that has shared, okay, Satabdi, you're back, so it's great to have you back. I hope your connectivity is much better now. Satabdi, I'll advise maybe you refresh your browser and then you come back to us. Okay, she's actually refreshing, so we hope she'll join us back in a short while. I was about to read this story from Wafa Abdurrahman that says, he said that this vaccine, okay, let me see where it starts. Yes, I'm a member of National EPI. I faced such a sensitive issue with one of the parents who was resisting to vaccinate their children with routine polio. he said that this vaccine will cause an allergy to his kid. Luckily, I was going to vaccinate my daughter with the same vaccine, and I told the father, if this harmed your kid, so it will affect my kid as well, and I'll take the full responsibility if anything happened to your kid. I took a long time to convince him, but I did eventually. So, François, while waiting for Satabdi to join us, you have listened briefly to that story that's shared here by Abdurrahman. What are your thoughts?
My thoughts, thank you, Abdurrahman, for sharing your story with convincing an individual parent. I think you have highlighted that to convince the parents, if you do your own child, and luckily it's only one vaccine, one dose of vaccine as well, but you imagine that if you have to go and immunize your child, for convincing many parents, a bit difficult, I suppose, but it was a very good solution on the spot, and you talk directly to the parents. I think we've learned a lot that you have to talk directly to the parents. Going through radio, not as convincing, are facing the parents, the local community with a problem. So I think this, like parents to you, and obviously it was you managed to trust. But my question to you, Abdurrahman, is, you say it took a long time. What was the main reasons? Did you find many other reasons? And why some of the reasons didn't work until you immunize your child?
He's not here on the panel, but Wafa Abdurrahman,
if you could hear François, maybe you want to give us a...
Yeah.
No, I wanted to invite him to share his audio and video, and then we can invite him to the. We can invite him to the panel.
Yes, yeah. Maybe you want to. Yes. Abdurrahman, if you can hear us, can you request to share audio and video? So you could give us. You could come in.
Audio and video.
And give us more.
So we're actually waiting for him. We are waiting for him. I'm waiting for him to ask to share his audio and video, and then I'll invite him to the panel. While we are waiting for him to do so, there's Emmanuel Katigua that says, Wafa, it is not advisable to commit to take responsibility for what happens to his child. There could be coincidental side effects that may not be due to the vaccine. I think that's quite an interesting comment. And Emmanuel Katugwa is asking to join the panel. I will invite you to the panel, Emmanuel, and I'll also be inviting Abdurrahman to join. So François asked his question where Abdurrahman will be able to join the panel. We'll ask François to respond to the question again. But meanwhile, François, I wanted to find out from you. You have listened to the proposal. Emmanuel, okay, Abdurrahman is joining. So, Emmanuel, yes, François, over to you.
No, I think it's a very good point. I think as an individual, you cannot take responsibilities. Your Ministry of Health is responsibility when they push for an intervention, but not. I think it's a very good point to say, be careful saying I take full responsibility. Something can occur, which is coincidental, is not due to the vaccine. But I don't think you should carry the responsibility. I think demonstrating with your child that you trust. Every vaccine has some risk, but the risks are far lower than the disease itself, so that you can go and that you have evidence. Immunizing your kid, you can do it once to convince the community. I think many experiences that we have learned during the peer exercise have proven that it works very well. I think looking at the Mr. Biden immunizing officially made a big difference. Dr. Fauci, I think the example of people who lead to immunize themselves or immunize their kids is definitely and has a far bigger audience than an individual, but it's always a success story to convince an individual, but a bit of cautiousness on your own responsibility.
Okay.
Thank you very much.
Thank you very much for that response. So we have Wafa Abdurrahman now. So Abdurrahman, if you can hear me.
Yes, I'm hearing you all. Hello.
So please, can you share your experience with us so that François can give us feedback? So you are trying to state.
It's all mentioned in my comment there. I actually, yes, I took the full responsibility. I told the parent that I would take the full responsibility because it took a very long time for me to convince him, and I couldn't find any way to convince that father actually. So to give the chance for that kid to take his routine vaccine, I told the father that, okay, if you are really afraid, so I will consider your child as mine. So I will take the full responsibility after vaccinating your kid.
I think it was,
actually, this is not like a logic to say that. It's not, sometimes, it's not correct to say that. But what to do with such kind of fathers?
No, you have a very good point. But I think you have to be very cautious. Of course, the risk that the child got a problem is very low. So you've not taken too much risk, but you have to be still very cautious. It's a success, but I would be cautious to recommend to many colleagues listening that approach. They were taking responsibility, but immunizing your kid is what makes the difference, I suppose. Can you confirm?
Sorry?
The fact that you vaccinated your kid was the most convincing argument for the father? Or it was taking full responsibility, the major argument?
It was a routine vaccine. So it should be given to all kids, but that was his first kid, and he was not taking him for vaccination at that day. He was taking him for to one of the pediatricians at the health facility. And then the general practitioner, the doctor there, the pediatrician asked him if his kid already taken all the vaccines or not. He said no, only the BCG. He gave him only the BCG.
The experience in other countries have shown that the more you question and listen to the parents, I know you've done a long time, it has taken a long time. What is the truth and where does he earn? And showing the experience that means there was measles before and children died from measles, maybe children who died when it was a vaccine preventable disease. But I think you have to, of course, and maybe you should be guided on all the stories that have managed to convince a parent to get immunized. There are many experiences that could be shared. We have heard a lot. And every experience is useful because it may apply to our own context. Of course, you succeeded, and that's great. It's a success. But one issue that I would be cautious on the responsibility that you have taken yourself when it is the responsibility of the Ministry of Health to immunize the kids, and the individual responsibility. In some countries, it's mandatory. In others, it's not mandatory. So when people have big argument about it, so just a lot of cautiousness, but at least you succeeded, but be cautious.
Okay, thank you very much for allowing me to explain. Thank you. I will be waiting for the replies from the panels.
Okay, thank you very much, Wafa, and thank you, Francos. Thank you very much, Francois. So please, we're going to hear from Emmanuel Ketungwa. Emmanuel Ketungwa also wants to share experience. So Emmanuel, are you on the line?
Yeah, good afternoon.
Please, the floor is yours.
Yeah, thank you. Good afternoon, Charles.
Good afternoon.
Yeah, good. And all the panelists. I was going to actually comment on a lot of the things that François Gasse said. And I quite agree with him. And I think he just summarized what I wanted to say. Thank you very much, Charles. You can give somebody else.
Okay. Thank you very much. That really shows that our senior panelist, François Gasse, is actually, hitting the nail on the head. So please, what of Daniel? We have Daniel on the line also. So Daniel, can you hear me? If you can, the floor is yours to share your experience.
Okay, yes, Charles. Yes, Charles, can you hear me today?
Yeah, I can hear you perfectly.
Okay, my name is Daniel Haruna. I'm a medical doctor. I work with WHO. Sometime in 2017, I was a supervisor during supplemental immunization activities in a part of the municipal and federal capital territory in Nigeria. And I was dropping from a Hilux, a four-wheel vehicle, when I encountered a team that said to me that I was to supervise in the area, that some group of people have rejected, or a man, about 2 children have rejected to receive the oral polio vaccine. And I said, what was the reason? He said he's not interested. And I said, can you please take me to the man? Just not knowing that that same man with the 2 children, he was seeing me, I was dropping from the vehicle. And I greeted him. And because I could speak the languages, he could listen easily. That's his Hausa language. I spoke with him and I asked him. I introduced myself and I asked him, I said, sir, please, I want to know the reason why you hesitate that you don't want your children to receive the OPV vaccine. He said, why is it that government give vaccines free and they don't pay his hospital bills while he takes those 2 children to the hospital? I said, yes, you are right. You have your right to say no, and you have your reason why you don't want. But I want to say something to you. I told him, looking at me, I'm a polio survivor. Looking at the children, if you refuse to immunize the children with the OPV, you might not know the next days, or they might become polio, they might develop the disease. And if they develop the disease, most likely some of them, they might be interested in becoming either military men or the armed forces of Nigeria. And with that, when they grow older and they found out that they have poliomyelitis, they will ask, were they not giving those vaccines when they were children? And the mother or the father said, yes, I said no, they shouldn't give you. And they would blame the parents. Why were they allowed not to be given the vaccine and now they have developed polio? So the father now looked at me and I told him and I said, sir, these people that are watching, they are only sent to immunize those children. They have no business with providing roads or water or paying your bills in the hospital. That is a government responsibility. And you have the right to write a complaint and send it to the complaint commission for the Nigerian government and let them know that why are they always bringing immunization and they are not repairing your road or paying your bills in school. And he looked at me. After 5 minutes, he now said, so you want to immunize my children? I said, yes, sir. He said, why? Because I have polio and I know what I'm passing through. And I told him and I said, sir, your children might not have the opportunity of becoming a doctor like me. You can see I'm dropping from a big vehicle. You might not have that opportunity. They might suffer with this disease in their life and they will regret that you were their dad and you prevented them. And he said, okay, I'm sorry for that. And he allowed his children to be immunized. And the people surrounding there, they were watching and they were so amazed. Because they were hearing the language I was speaking. I wasn't speaking English, I was speaking the traditional language that we spoke in our area. And within 5 minutes, you could see other children were being brought at that spot for children to be immunized. I immunized over 18 children at that very spot, that very day. So that is my story. And I think with that, at times we need to read dialogue with people, we need to let people understand the gravity of the problem. Some hesitancy might not explain like the way I was able to explain myself using the OPV. But some of them will need to meet with the people, sit them down, discuss with them, show them the relevance, the importance of those vaccines, and then allow them to take their decision. I think it will go a long way. Thank you very much. That's my story, Charles, and off I go. Thank you.
Wow, thank you very much, Daniel. That was really a wonderful and touching story. In fact, it bears so much meaning. But quickly, let's hear from François, if you have something for us here. François, you have feedback for Daniel?
I think, thank you, Daniel, and it's a very nice story. And how, what was nice is convincing one person, you succeeded in 18 children being vaccinated. What I hear from your story is that you really try to understand first the father before coming to propose and explain how. I think people are not listening enough, and when they are clever, they will listen. If you provide the right answer, they will change their behavior. So I think listening before jumping on the parents was I believe, a very good approach, and you really try. And I think in the word you use very concrete things that people can understand. And the third point where I want to highlight, which maybe is not done enough in many countries, is speaking in the language that the parents understand.
Yes, sir.
I think, I don't know if it was Hausa or whatever, but I think then the others could also listen to you. And I think it's a respect when you told your story, because in English they would not have understood half of what you were saying. So I think using the right language, answering the question after you have asked question and you know why the person, and bringing in a little community, not very educated, very concrete example of what vaccine do seems to have made the difference. So again, one question I have for you now, you know, you went and you were a supervisor, but how would you prevent in the next polio campaign? Because I'm sure Nigeria will have many more polio campaign, and maybe in some area many. How would you prevent? You cannot be everywhere.
Yes, sir.
How would you prevent on a larger scale, with your experience, similar cases?
Okay. Okay, Francos, I'm suggesting, you know, people need, first of all, to understand the terrain where those things are happening. They need to understand the terrain, and then they need, just like the way you explained, I was able to speak Hausa to that very person, and he understood the mechanism of vaccines and why he needs to give to these children. So when people have that understanding, first of all, it's not about saying I must immunize your child. No, discussing with the person, understanding the need of that very commodity you want to sell to the person. Understands the need. She might say, okay, I want to buy. It's marketing. It's social marketing. When we don't put social marketing in vaccine issues, you might not be able to sell our vaccine for people to say, okay, please immunize my child. Because now people are really hungry. They will tell you, I need food, I need this, I need that. But when we convince them, train them the need, I think they will be able to avail themselves. And I think it's simple for people to understand, for us to come to such levels. I know I might not be everywhere to use myself as an example. Thank you, Frago. I hope I've answered. I'm not going to attempt to answer your question, sir.
I think you have responded very, very well to my question. It's very clear. They need to understand the why you need vaccine, and people will understand, and speaking a language they do understand. Now, was this done before the campaign, or there was some gaps of communication in the campaign? Because it's not the first SIAs in Nigeria. So,
yes, sir.
Where are the gaps in communication? Is it just very small communities, or some gaps could be covered in the future? So communication.
No, so that very community, the issue was that they were. It's dominated by a Hausa community. You know, we have issues, particularly for some of us that come from the northern part of Nigeria, where people have developed resistance, despite the explanation on the need for them to have those vaccines. So that very community, I don't know, I was now sent to supervise. I don't know why my supervisor decided, okay, I should go to supervise that community. And I went because he's known for resisting vaccinators to enter those communities. And I decided to enter because there is the Islamic scholar that usually help those vaccination teams when they go there. But that very day, he wasn't available. So thank God I was there. So I needed to do what I did in order to get those children vaccinated. Sir.
Okay, thank you very much. Over to you, Charles.
Thank you, Francois. Thank you for that wonderful input. So, like Daniel said, if we don't put social marketing in vaccine issues, we will not be able to achieve the objective. So thank you very much, Daniel. I think that message has been passed across and understood as best as possible. So we have other persons in the panel that are trying that would like to share their stories. So we'll hear from Bashir.
Please, Charles.
Bashir
Charles,
hello?
If you permit, we have just 2 minutes before the end of the session. The session is supposed to end at 45 minutes, and you have to go over for another instant remote coffee. So I don't think we can listen to a story now. So what I would like our three panelists that have just joined, that is Bashir, Mercy, Onu Peters, and Felicia, will just to be able to share in a few words what are their thoughts based on the different stories that we have listened to today. And then we'll give the floor to Francois for the closing remarks.
Okay, thank you, Charlotte. Thank you very much. So, Bashir, can you just, you have 1 minute? Okay.
Hello.
Yeah, Bashir, we can hear you.
Okay, yeah.
You can
I'm Bashir
from what you gathered from the presentations.
Okay. Yeah, I'm from Kano, Nigeria. Yeah.
Yes,
well, my story is about just similar story to Daniel. Hello, can you hear me? Hello.
Yes, we are getting
we can hear you.
Yes, loud
yeah,
and
yeah.
clear.
Well, my story is with regard to blood projection as a result of the vaccine hesitancy during supplementary immunization activities in Kano State. We were just in one hard-to-reach village area where the whole of the community refused to take the vaccine because of certain felt need. They were saying that the government is not providing a good work for them. There is no hospitals, there is no schools in the community. Then why are they coming to vaccinate their children? We try trying to convince them the difference between what they are looking for and what we came to do. But at the end of the day, we are unable to achieve it. But luckily for us, we will have what we call the FGA evening review meeting. We discuss it with the district head and the traditional leaders and the religious leader. They were able to go down to the community to convince them about the importance of this vaccination. That's how they were able to collect the vaccine. But based on our own efforts in enabling to get this vaccine, was also safe until we involve the traditional leaders and the religious leaders. And that's the story I intend to share.
Thank you, Bashir. So quickly, we'll hear from you, Mercy. Please.
Hello.
Mercy. Yeah, we can hear you, Mercy.
Hello.
Yeah, Mercy, we can hear you. Hello. So, Mercy,
hello, can you hear me?
If you can't continue, we can hear you, Mercy.
Go ahead.
Unfortunately, we can't hear you well.
Mercy is having network issues. So, Felicia, are you there?
Just a quick one. Thank you so much. This is Felicia from Nigeria. On vaccine hesitancy, the sect, then you consider the occupation, you consider their movement mapping, and then you consider involvement of their leadership. Who do they really respect? Daniel just spoke, and I know Daniel knows what I'm talking about. We have a set that are categories, but you consider them and then select somebody from their clan that can really assist. We're talking COVID-19, COVID vaccines now. Those sets have to be given attention, and their traditional leadership matters a lot. So we have to be all involving to achieve results. Thank you, and over.
Thank you very much, Felicia. I believe we've had all. I want to say thank you to everyone. So, François, could you just give us a closing remark?
I think
thank you for a wonderful session.
I think I want to thank all the presenters because we have a list of messages which were, I believe, very critical that have been put forward. And I think if I start backward, if I start backward, I think the last two speakers, I think highlight important to involve traditional and religious.
Hello,
I can hear you. Can you hear me, Charles?
Yes, François.
I can hear you. François.
I think the importance of really involving the traditional and religious leadership at community level to the lowest possible level to get the adhesions of the. I think what we have learned also is to really understand and ask questions to the mother of the community on why they don't get immunized and making sure you start by questioning the deep root cause before you involve in solutions. Because if you are listened and you prove that you have listened to them, it's very important. I heard another message just now, the complexity of between government doing vaccine and having no access to health facility. It's a very delicate But I think you have addressed it well and say this prevents disease. So at least you will not go to the hospital for that disease. And I think addressing the risk and separating the vaccination from the need of the disease is very important. And I think we have heard also that you can tell to people what they need. And I think if you understand the need, they will come to you to get immunized. But if they don't understand the need, why would they come and be bothered? That was very important. And I think we have heard to be very cautious before you take responsibility yourself for what could happen, very rare event, but be very cautious. It's a Ministry of Health who want to do good for their population, and we try to help that. But it should not be used really as an argument because you're taking a risk even if it's infinitesimal. So I would like to thank everybody for having brought all those very interesting case studies as a solution to many problems that everybody will face in one area. The last thing I think which has been very important is to speak the language of the person you talk to. It's already a respect and will be an understanding, otherwise will be very superficial understanding. So the house story was a very educative one too. Thank you very much.
So thank you, François.
Thank you very much.
Thank you, Charles.
François,
yeah, so thank you really, Charles, for moderating the session, and thanks to everyone who has contributed on the chat. I see Laura Shimp was able to join us, Laura Shimp from JSI, one of the partners of this conference. So, and we are glad, Laura, that we were able to share very constructive comments on the chat. I hope you all took advantage of that. So right now, I'll be inviting you to go over to networking. Let me just share the link on the chat so that you can get to meet any conference participant for an instant coffee, and see you at exactly 5 p.m. Geneva time. We'll be having another session. I'll be in another session on infection prevention and control during the introduction of the COVID-19 vaccine. So if you can make it there, I'll share the link here on the chat. See you in about 9 to 10 minutes. And bye for now.
Everyone.
Bye. Bye, everyone.